Hello, ladies and gentlemen. Welcome to Triple N. Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I'm going to test and see if ChatGPT can be an useful source for providing specific information to the patients. Say you have a website, or a hospital or an institution has a website, and they want to provide healthcare information rather than storing hundreds and thousands of web pages pertaining to each particular disease. They can put a link to ChatGPT, and the patients can ask specific questions that can be answered by the ChatGPT. So let us put this to a test drive and see what it comes up with, and how useful the information is, how accurate the information is, and how reliable the information is. First of all, when it comes to reliability, the ChatGPT itself says, I am not a medical professional. You need to seek medical professional guidance for any type of recommendations. But nonetheless, ChatGPT does provide some useful educational information. So let's put it to a test drive. So I put in here 56 years old patient comes for checkup. He has hypertension, diabetes, coronary artery disease, heart failure, and reduced exercise tolerance. What do you do? So ask ChatGPT, if this ChatGPT were the healthcare professional, nurse practitioner, doctor, nurse, whoever it is, what would you do? And it came up with, it says you do a thorough physical examination, order appropriate diagnostic tests to develop a comprehensive treatment plan, and encourage lifestyle modifications like diet, exercise, stress reduction, weight control. That's well and good. So that is a broad introduction. But I asked the next question: what treatment do you recommend for each condition? So let's see what it came up. For hypertension, it said lifestyle modifications, exercise, health, or diet, and medications like ACE inhibitors, angiotensin receptor blockers, calcium channel blockers. So we're getting a little more specific here. Same thing with diabetes, like metformin, sulfonylureas, insulin. And for heart failure, it made pretty decent recommendations with ACE inhibitors, ERBs, beta blockers, diuretics, lifestyle modifications. Okay, that's well and good. Name some blood pressure medications. That was my next question. It came up with diuretics, ACE inhibitors, beta blockers, and it tells exactly what these do. Diuretics helps to reduce the blood pressure by reducing the salt and water in the body. So I said, what are the doses of these medications? This was too generic, so I don't want to spend too much time here, but I wanted to be more specific. I said, name some specific diuretics. Give me the names of the diuretics used for hypertension. It came up with the thiazide diuretics like hydrochlorothiazide, chlorthalidone, metalazone, loop diuretics like Lasix, furosemide, torsemide. So that's pretty good. So these are real names that we use routinely in our practice for patients who need diuretics, and also it came up with this. So can it be more specific? So I said, how does metalazone work? Metalazone is a diuretic which is unique compared to the Lasix or the furosemide that we use, because it works in the distal convoluted tubules of the kidneys. The kidneys has a little, like a glomerulus. From there we got the proximal tubule, then we have the loop, then we have the distal tubule. And this metalazone works specifically in the distal tubule. And see what this one says. Metalazone is a thiazide diuretic that is similar to thiazides by excretion of salt and water from the body through the kidneys, specifically reabsorption of sodium and chloride in the distal convoluted tubule. So it got a little more specific. But it gives you a general idea as how these medications work. Why do we need to take these medications? And increases the sodium and chloride in the urine, and that reduces the blood pressure. So by asking a series of questions, patients can get information, but not all the time the information is going to be accurate. but nonetheless, it improves your knowledge base. It helps you to get a better understanding of what your medical condition is and what medications you're on and how do these medications work. And you can also type like what are the complications of hypertension. See what it comes up with. Hypertension can lead to a number of complications, and these are the things we need to keep in mind. Cardiovascular damage to the blood vessels leading to atherosclerosis, heart attacks and strokes, and kidney damage, hypertension damage, eye damage, blood vessels, blindness. Hypertension can increase cognitive impairment, dementia. Yeah, I think it's giving you too many things here. You get the general idea. So if you have been diagnosed with a new disease like diabetes, you can just sit and ask a series of questions to improve your knowledge or improve your awareness of what to ask your healthcare specialist, the doctor or a nurse, when you make a visit. Make a list of these questions so that you become a more informed patient, which helps to better health lifestyle. So there are pros and cons to using ChatGPT, but you have to determine on an individual basis and see how much information was useful, how much was too generic, and how much was like misinformation. So, ladies and gentlemen, this is a quick overview of how ChatGPT can be incorporated into like a medical office practice, where you have a web page which answers questions to every conceivable disease that you can think of, instead of writing a page for like cold, flu. Like this would be great for like specialists. Describe the procedures and all these different things in an interactive format, and that's what I think will come into. Whether we like it or not, artificial intelligence has been quite useful in summarizing medical records, preparing discharge summaries, and collecting patient information and coming up with composite reports. There are multiple ways in which these healthcare applications can be useful to the patient, to the doctors, to the institutions, and for the general public in improving your overall health. What do you think? Do you agree? There are a lot of medical healthcare professionals. This is just another like a fad. It will be here, and after some time it will go away. I don't know. What do you think? Let me know. I have several other videos of ChatGPT medical uses, so you can take a look at them. Thank you so much for watching, and I will see you in the next presentation. Thank you so much.